Hello everybody, and today we're going to study two things. We will study about human skeleton and something about human lungs.
Well, good evening everybody. Thank you, Dr. Miran. All right, and thank you everybody. Okay, so the human skeleton. Yeah, sure. All right. Yeah, this is better. The human skeleton. All right, so the human skeleton. Well, so what is a skeleton? What do you think?
I think skeleton is is the one of the main part of our body.
Yeah.
Like everything in our body, but it is. I think it is the main part because every organs and like the main structure of our body is only because of our skeleton.
Yeah, sure. You're right. So it means without the skeleton, the human being would be very weak.
Yeah.
Would become blobby. It could just fall
like
down.
water.
Yeah. So, so the skeleton is just a structure that helps to give us strength, maybe to stand, to bend down, to do other things. Yeah, sure.
Mm-hmm.
Yeah, yeah. And generally, skeleton is mostly consists mostly of bones. You know, bones.
Yeah.
Yeah, bones. Actually, this is just a sort of maybe model of a skeleton, but here we could have some major representations of the skeleton, how they are, how it is. Okay, so here first is this skull. You understand?
Yeah.
Yeah, the skull. And actually the skull is made up of some bones. You would see here there are some sections here. So this is the frontal part of the skull. Yes? And here is the parietal side, right. So let's say this is the right side of the skeleton. This is the parietal side. And this is the left parietal side. And then you see the occipital bone behind. Occipital, yeah, is the back part, you know. And here at the back part, you get some muscles. Yeah. Remember, the skeleton helps to attach muscles. Mm-hmm. No, muscles, like the occipital muscles at the back of the head, the frontal muscles here, and then you see, so this scalp, S-C-A-L-P, scalp. So the scalp, then you will say S-C-A-L-P. Well, these are the layers of the head bone, you know, when you see. Okay, now, very, very important. Remember, if maybe surgically we open up the skull, what do we see?
Brain.
Here, we see it like this. You understand? Here, it's a cavity, big cavity here that contains the brain.
Yeah.
The brain is very, very important. And then if you pull it out here, yeah. So this is how it looks like.
Yeah.
You see it here. Yeah. This is the mouth part.
Mm-hmm.
And here is the cavity we're talking about. Then you see some connection. Then here, so when you put it like this, yeah, it's almost just like that. See? And the brain is right inside there, covered with this.
Yeah.
So God forbid, in case of accident.
Yeah, like to protect our.
Yeah, so this skull helps to protect the brain. And inside the brain, there are many structures, you know, which help to protect the brain. Okay, if you look at this structure, this hole like this, there's a hole behind. Mm-hmm. Yeah, that's this. This is just, it passes through here. There's a foramen here that connects the head to the cervical vertebrae. So this is the spinal cord that passes. You know spinal cord?
Yeah.
Yeah. The spinal cord, what is it? What is the spinal cord?
Like spinal cord
Yeah.
is the thing
Yeah,
that connects our back,
yeah,
like
Spine. Yeah.
with the brain. So the brain can send, I know how to say this, to send messages
yeah.
for our body, like maybe to move or make some exercises.
You're right, you're right. Okay. So if we see generally, it's almost like this, something like an S form. This is the spinal column. So this is the back part, spinal part. This is the frontal part. Then you would see here, there are some bones over here. And those bones, what do they do? These bones help for muscle attachment. Muscles attach to these bones and they continue. So if you see the shape of the spinal column here, it goes like this, like an S. You see, S shape. You see like this?
Yeah.
Like this. And then here, it comes here to coccyx. The last bones here are called coccyx or coccygeal bones. Here is the spinal column, just let's say the spinal cord. And remember, as I said, this is the frontal part, but from the back, you see the spinal cord comes from here, from the bone. So it connects the brain down with the spinal nerves. Spinal nerves are here, and also there are nerves we call cranial nerves. Here, and also here, this spinal cord goes as strength. It strengthens the bones here with muscular attachment, muscles. Remember, this is a brain structure, and it's made up of nerve cells, nerves. So the nerves come here, and from here, they pass out onto the foramen here. This is the central foramen. So it gives branches out here, and remember, comes out here. So in general, this is the skull, and this is the spinal part. This spinal part here is divided into cervical part. Cervical means the neck. You understand?
No.
Cervical part. There are about 7. You see here, the bones here, atlas, axis, you understand? And then down, 1, 2, 3, 4, 5, 6, 7, about 7, yeah, cervical bones. Then from there, this helps to protect the neck area, okay?
Yeah.
So like here, you could turn, yes, you could turn, or you do it like this. So this is with the help of the atlas bone and with the axis bones. Now here, remember the nerves come out from here, and then they are directed, like in your body. You could see, if you touch the neck, you could feel with the muscle attachment. Okay, here you go further. You see here the first rib, over here, the first rib, and then you see the clavicle, like here, you touch here, you see the clavicle. This is at the other part, at the frontal part. But at the spinal part, you see here the ribs. And you will see here the pectoral girdle. Pectoral girdle is for the attachment of muscles of the shoulder. They call it shoulder blade. Here, there you are, with some muscles attached to them, and also some muscles attached here. And also here, as I was saying, there are ribs here. How many ribs do we have?
Like maybe 13,
Okay.
16, maybe like that.
Okay, yeah.
I haven't counted.
You haven't counted? Okay, come and count the ribs. And to see them properly, okay, you could count from behind, but you could start
So-
from here.
Like This is one. 1, 2,
Mm-hmm.
3,
Yeah.
4, 5, 6, 7, 8, 9, 10, 11, 12.
Correct.
Yeah,
Correct.
12.
12 pairs of ribs. So on each side here, like here, yeah, 12 ribs, and here 12 ribs. So it's called 12 pairs. It's just symmetrical, symmetry. Symmetry. What you have at the right and what you have at the left. Okay, that is it. And to see it very well, okay, well, we will talk more about this up to the coccygeal region. But here, the frontal part that can help you see much more. So you would see some of these ribs go directly to the zygote process. This is called the sternum. And in the sternum actually contains bone marrow. So for bone marrow transplant, sometimes they would just take the bone marrow from here, with heavy needle. Yeah. And for example, what happened in Chernobyl, in Ukraine, some time ago, so the bone marrow transplanter, a Jewish man, an American Jewish man came and was helping to get bone marrow to give to the people, because when there's radiation, the bone marrows are off, but you need some transplantation. Okay, so here is the clavicle here, and here is the first rib. So if you count from here, how many ribs do you see connected down here? But here, count them, connected directly here.
Like 1, 2, 3, and
say 4, 5, 6, 7,
8,
8,
9, 10.
9, 10, yeah.
Yeah,
But now it means the two ribs here are false ribs. They are floating. They are floating ribs. These other ones are just connected.
Very small.
Yeah, they are over small. But they are also connected with intercostal muscles, let's say for breathing.
Of course.
Yeah. And you see, this is the rib cage, that when we want to breathe, when you breathe in, yeah?
Yeah.
You see this will expand.
Yeah.
Then when you breathe out, this cage will come. Yeah. They will not expand. They will try to come back to the normal size. Yeah. So you breathe in like from the nose or from the mouth.
Yeah.
Then air enters here directly from the trachea down to the lungs.
Yeah.
Yeah. And then this rib cage expands. Then you breathe out. Then the rib cage will come back to its normal size.
Yeah,
okay. Yeah, thank you. All right. So as we were saying, the skeleton here, the spinal column is very important, because with it you can do exercises. You could bend down. You could, bend forward or backwards or sidewards. So it's elastic, and they are joined. Each process bone. Yeah. Is joined, and here we have cartilage in between the bones. Cartilage? Do you understand what's cartilage? Yeah. Something like this. So there are cartilages in between the bones. You understand? These are like this. These are cartilages. That's one bone joined to another bone with the help of a cartilage. Yeah. And also here, do you see some cartilages there? Cartilage. Do you see? Yeah. These are discs. Yeah. So this disc between the bones help to protect friction. You understand? Friction. Friction is, if you are bending down, if it is bone to bone, crushing each other, it will be very painful. Yeah? Yeah. But when you bend down, you will see this intervertebral disc. Intervertebral disc, that's what they are called. This intervertebral, between the vertebrae, yeah? They will help to protect you from maybe having friction. Also, we have here, at the knee joint, we also have some synovial fluid that helps to protect friction. So even when you bend, and remember, if these cartilages are destroyed, sometimes you would see what we have scoliosis. Do you know scoliosis? And we have lordosis. Lordosis, when somebody would bend forward like a lord, walking like a king. Okay? Simply because here there's some destruction of this, intervertebral disc. And then that's, then also scoliosis. Scoliosis, somebody would bend like that, just like that. You understand?
Yeah.
So these are diseases that are affected by our own vertebrae. So they are very, very important, especially the spinal cord. And then you see some sports that you do that you need, maybe high jump, long jump, running. Okay, even swimming. You need all the muscles and the bones. Okay, now here it comes to this place. And after that, okay, over here, up to here, you find the pelvic girdle. Yeah. It's part of fusion of the, then you can't see the sacral, the coccyx section. So these are divided into cervical section, thoracic section. These are thorax. Then you see the lumbar section, and then sacral section. Okay, so cervical, then you come and see thoracic part, the thorax, yes, thoracic part of the vertebra. After the thoracic, then you see the lumbar section. After the lumbar section, then you see the sacral section, sacral part, sacrum. Yeah, sacrum. These are the bones that help to form sacrum. And then you see the coccyx. Coccyx are just a few bones here formed. Sometimes there could be some problems during the formation of the coccygeal bones here. And then when a child is born, sometimes they need to do some operation to reduce it if it is, if it is not brought back to normal during embryonal formation. Okay, so the coccyx. So in general, let's say here there are about 7. Thoracic, how many? About 12. Then lumbar, maybe about 5. And sacrum, something about maybe 4, maybe 3. So in general, how many do we normally have? Let's say 7 plus 12, 19, plus 5, 24, plus 4, 28 plus 3.
28
Yes,
plus 3, that will be 31.
About 31, yeah, something like that. 31 fusions or something.
Yeah.
But maybe it could differ depending on maybe 33 or whatever. And also these are important because as you see each here, intervertebral space, intervertebral, you see nerve coming out. Like here we have cervical nerves. Nerves come out from here, the cervical section, nerves, here. You see, about 7 pairs of nerves that come out. You are the one. They normally call them C1, C2, C3. That is to show cervical nerves, Yeah. So also here, thoracic, you will see thoracic nerves coming out too, from the thoracic vertebra. Okay, what is important is here, you have the lungs inside. Yes, lungs for breathing. And also you have the heart. And after that, then you have the diaphragm. The diaphragm is the barrier. You understand? Okay, let's say towards some section about here, the thoracic part, you have here would be something like that. This will be, what have you? Hipper. I mean, up here. Then you see that the thoracic cavity. Then you come and see the diaphragm. See, the diaphragm is here, separating the thoracic, contents from the abdominal contents. You understand?
Yeah.
Yeah. Okay, then what do we have? Then you come and see here, iliac bones. For women, it's important. So if the skeleton is for a woman, you would see they would be wider, bigger. because of childbirth. When a child is being formed, here, the child will come and settle here. And over here, then you would see it's somehow connected to the birth canal when a child is going to be born. And then here, this is symphysis pubis. It's also a connection so that, the bones here would not crush each other. But yeah, they would expand. And here you see the urinary bladder. Also look at it down there. And then you just come and see here. That's it. Okay, very important is also here the hand like this. Yeah. Yes. Okay, so you see here the humerus, and here you see radius, and then you see ulna. These are the bones of the hands, and then you see here the bones here, metacarpals, and then carpal bones, and then you see they are just joined together. Very artistically, God has made everything perfect. Yeah. That you could come here, you see the 1, 2, 3, 4, 5, yeah? 5 bones. So, yeah, this is it. And then you will see over here, the thumb. And over here, if you see it, you have here is the anatomical snuff box. What do they call it in Russian? There's something табакерка. Anatomический табакерка. Because before, people used to take tobacco like this, with this. Yeah. So it's just like that. Here, this. It's made by tendons of muscles, But here, very, very important is the radial pulse. Get it like this. Over here, if you press like this, you will get the radial pulse. Let me show. If you go to hospital, then they want to take your pulse. Okay, let's say it's just like this, okay. So here you use this, and then but little like this, and then we will hear how your heart is beating.
Like the pulse.
Yeah, the pulse. So you press the artery. Yeah. Okay, so you take, this is the radial pulse from the radial artery, which is part of the brachial artery that comes down.
And when the heart is beating.
Yeah, it will transform the waves over here. So you could get about maybe 80 beats per minute for the adult. That's very good. So that's very, very important. And for holding something, and nerves, over here there's ulnar nerve that crosses through here, the ulnar nerves. So if you hold, here, this is this joint, and then you hold it like this, then if they press it, it could pain you, could be painful. That's how people in judo, when they are fighting, they come, or maybe wrestling, they come and hold you like that. They will say, it's because of this.
Don't do this.
Okay, now that is it. Then you come here. Yeah, this is the head of the femur. This is femur bone. This is the head, and sometimes in old age, sometimes it causes problem. This is the neck of the femur, and some muscles attaching themselves down there. Then you come here to very important place. This is the knee joint. So this is called knee cap. Cap, like a cap. So this is the knee. It has a cap, like you wear a cap. And actually, it's called the patella. And over here, as I told you, there's some disc here, then medial meniscus and lateral meniscus that help to protect the bone from friction, Okay, so it has even come up, So it's very good. So it's just like that. And if you want to see the back here, there's a muscle here that's called popliteus, and it joins here also for sports, And also there's another muscle here, sartorius, that helps you make. And remember here, this is the Achilles bone. So it has Achilles tendon that helps to join. So God forbid if there's any dissection of it, if it's cut, then you find that, there could be the leg would not be straight. So it's very, very important. And then you see here the tarsals, here the ankle bone, ankle joint, and these are the tarsals, then metatarsals, And then you also see to the toes, the big toe and other toes. Very, very important. That was about the skeleton. And remember, it's very, very important. We can't do without skeleton. But now, we have, in general, okay, do you know what it means, endoskeleton and exoskeleton?
I don't know what it means, like, endoskeleton.
Okay. Endo means inside.
Oh.
Exo is outside.
Like, endoskeleton is everything inside the skeleton?
Okay, exo, outside. Now, like this skeleton is inside the body because you can't see it outside. Yeah. So it's called endoskeleton. Examples of animals with exoskeleton, just think about it. You understand? Can you think of some animals with exoskeleton?
Maybe nails.
Snails.
Snails.
Yes,
Snails.
you're right. So you see, here is exo, yes?
Yeah.
And apart from that, what again? Then you see something like that. Then you see something. Maybe it's not so clearly, but turtles. Do you know turtles? Tortoise, yeah. It has the skeleton outside while the body is here. You understand? But the human being, you see the skeleton inside, well designed and covered by beautiful muscles and then the skin. Okay, well, in principle, in conclusion, what I wanted to say is that the skeleton is very, very vital to the human being. And each section of the skeleton, like here, the skull, the cervical section, thoracic section, the lumbar section, the sacral section, the coccygeal section, and all other sections like this, these lower limbs, yeah, they help to, in each different functions, especially like here. Do you know, like when we eat our gaster, you eat food, it goes into the stomach.
Yeah.
And the stomach is being protected by this part, the abdominal part of the skeleton. And you have, this is the frontal section, and that is the spinal section, the back section. And even when you want to sit down, you are being supported by the ischial bones. This bone is called ischium, and well designed to cover with muscles so that they would not, you wouldn't feel hot. But remember, if somebody becomes thin, probably the muscles are weighing out, and then you find out that there could be problems. And then what helps us maintain our skeleton? What elements do you think help to support our skeleton? What do you think? Something like mineral, say calcium. Calcium.
Yeah.
You know calcium?
Yeah.
Ca2+. So when you take calcium, it helps you to be strong. Your muscles, your skeleton will be strong. And also, remember, children, when they are born, when they're young, they normally go in the morning for strolling in summertime and in the evening, because the sunlight, ultraviolet rays, help for the calcium to be absorbed into the bones to strengthen the bones. So calcium is very, very important. Yeah. Okay.
I think I understood everything about the skeleton. Maybe there are some more parts about it.
Yeah.
But that is like the higher level. I think so.
That's good. Okay. Thank you very much. That was good. So we hope you take care of your body, take care of your skeleton, and do exercises, to strengthen.
Morning.
Yeah, every morning to strengthen your skeleton. Okay. This is the second part. We are going to talk about the lungs. Okay, so first and foremost, what are the lungs? The lungs, Lungs. Yeah, the lungs. In this case, the human lungs. So what are the lungs? What are they?
Like the lungs, it is an organ that helps us to breathe, and cause we can breathe, we can live. There's like the main function of our lungs, our organ.
Okay. All right. You're right. So you're trying to say that, yeah, the lungs help us for breathing. You're right. Okay, so generally you would have that the lungs come like that, and then you would see some things like that, then something like that. Okay. So what do you think this is? Something like that. What is this?
This is, I think, I forgot the name, but this is the part of our body that helps the oxygen go to the lungs so we can breathe.
Yeah. So if you consider this is the human head, the head part. Yeah.
And when we breathe the oxygen inside, the trachea.
Okay. This is a trachea. It's called trachea. If it is more than one, it would be tracheae. Understand? Trachea. Plural. Not tracheas, but tracheae. So one is trachea.
Yeah, and the trachea helps oxygen go through it inside our lungs.
Yeah. So when we breathe, let's say we breathe from the nose. Yes. Generally, it's better to breathe through the nose. Why? I mean, in normal situations, it's good to breathe through the nose because when you breathe through the nose, not through the mouth, but sometimes you breathe through the mouth in certain situations. Maybe you are running, and then you need a lot.
100 kilometers you need to.
Yeah. Okay. So why do we breathe through the nose?
I know.
You know it. It's because the nasal linings have got hair inside the nose, hair. And that hair helps to filter the air to prevent bacteria from coming to destroy our nasal cavity. Yeah, so it helps. All right, so, and it could also help to make the nose, moist or dry or whatever, moist. Yeah. Okay, so when you breathe in, the air goes through the trachea, goes down here through the bronchi, The one is bronchus, yes, you understand? Yeah. Bronchus, if it is one. If it is two, it's going to be bronchi, So this is a bifurcation of the trachea. So one goes to let's say this is the right lung, yes? Lung. And this is the left lung. Yes? Yeah. Okay, that's just like this. You stand like this, and then there's the right part, there's the, Like here, as you see, here from the nose, here in the skeleton, the trachea keeps going. If you touch here, you see here the trachea up here, and you see a sort of joint here. It's called Adam's apple. It's a sort of cartilage to protect you from, getting the trachea damaged. So it goes, the trachea keeps going, and here it comes directly into the lung. Yeah. And also you have the oesophagus. Oesophagus, that's when you eat food passes through the mouth, then into the oesophagus, then down to the gaster. But here is trachea. Okay, here, all these are in the thoracic cavity. You understand? So when you take the lungs here, remember the lungs is a sort of elastic organ. Elastic. Why is it elastic?
Like when we're breathing inside, we need lungs to I think.
Expand, yeah?
Expand, yeah.
You take in air, as you
Yeah.
take in air, you are
And
adding to the
if there
volume.
are- yeah. And I think the lungs become bigger when we breathe.
Yeah, so
Breathe
the lungs
inside.
expand,
Yeah.
yes. And now when you want to breathe out, the lungs become smaller.
Yeah.
So the
Oh, like usual.
yeah. So the elastic nature of the lung tissue helps for breathing. You understand?
Mm-hmm.
Yeah. Okay. So how many breathings do we have? An adult person have a minute. How many, breathing oscillations do we have? When you breathe, yeah. How many times a minute? About 15.
15 times a minute.
Yeah, times per minute breathing. So sometimes you may have what we call maybe fast breathing because maybe you are doing sport, then you could breathe more. Or sometimes if it's in normal circumstances, probably it's due to deficiency of oxygen. If you're a mountain climber, you climb. The higher you go, the less the oxygen, then your body will try to support you without, that's what we call apnea, tachypnea, all this. Yeah. And those sometimes, and also connected with hypoxia. Hypoxia is deficiency of oxygen. So if you go to a place, the oxygen is getting less, then your body will try to make you breathe normal, then sometimes the changes will occur. You understand? Well, as we were saying, here, this is the apex of the lung, apex. That's the upper part, apex. You understand?
Yes.
Yeah. This is the other apex. So these are the basic. Here is, this place is called lingula. Lingula. Why? If you remember, why do we have this? This one is like this, the curve, but here seems to go inside and then you have this little part of the lung
I
coming
know
out.
why the left lung is so special.
The left lung, why?
Maybe there are more oxygen in the left lung, and maybe the left lung has more place
Okay,
to contain more
Okay.
oxygen. I don't know.
okay. You remember the other time we talked about the heart,
Yeah.
the heart. So part of the heart is here,
So it is.
So
comparable
it's
for
just an
heart.
impression made by the heart.
Yeah, now I understand.
Lingular, yeah. Okay. So the heart and the lungs, they are coordinated, very, very related together. Because here. Okay, now, if you take the lungs, they are divided. You would have some sections. Some of them are divided into different sections, which are called, actually lobes of the lungs. These are the sections of the lungs. For example, you take a lung like this, you could bring a lobe, cut it easily into this part, then you could cut the other one maybe from here, just like that. These are called lobes, or lobes. Then the lobes are divided into smaller ones called lobules. Lobules. These are smaller, yeah? And under the microscope, when you look at the microscope, then you look at the lung cavity, yes? Okay. You can sometimes see something like this here. So you see something like this. Remember, mostly, what do we have here?
Oxygen.
Yeah, this is oxygen. The main function of the lungs is for exchange of oxygen. Yeah, with the other cells of the body, especially blood cells. You understand?
Yeah.
Okay, so when you breathe in here, the air goes into the lungs and then into the different sections of the lungs, and then you would see here oxygenated blood, oxygen, yeah, nated blood is reddish red, very red. You understand? Mm-hmm. So from the lungs, the oxygen is carried to different parts of the body when you breathe, by some blood cells. How do you call the blood cells?
Blood cells.
Blood cells that carry oxygen to different parts of the body. They are something like that, Mm-hmm. Almost like that. Then you see some here. This blood cell is called erythrocyte. You remember?
Yeah.
It's called the red blood cells. Red blood cells, RBCs, yeah? Or erythrocytes, yeah? Yeah. Erythrocytes. There are millions of them in the body, yeah? Very many. Now, the oxygen from the erythrocyte here, that's what we call ferrum, iron. So iron combines with globin. Do you know globin?
Yeah.
To form hemoglobin. Hemoglobin. What is hemoglobin? It is the iron here with globin. Globin is what we call bulky protein.
Yeah.
Yeah. So with the help of this iron, it helps to convey oxygen to different parts of the body. Very, very important. And when the oxygen is given to the different parts of the body, like to the muscles, then you see the muscles act quickly, or to the brain, especially to the brain acts quickly. But when there's no oxygen, you see, you feel dizzy, you become dull because oxygen is not there. So when you are in the rooms, you just need to open your windows and then bring in fresh oxygen. It's very, very important. And your blood will flow. What I was saying, when this is how the oxygen is conveyed. Here is in the lung alveolus. The unit of the lung is called alveolus, the functional unit. You understand? And also as the functional unit of the kidney, what do you call it? You remember the kidney? Yes? Kidney like that here?
Yeah.
Yeah. Then like this, like this, like this, like this. Yes? Blood coming in there, this. Here, the functional unit of the kidney is called nephron. As we said the other time. A nephron consists of, here the capsule, Bowman's capsule. Okay, something like this. Remember, when we drew like that, then we come here, then we come here. Yes? Then it comes here to the tubules, yes? Mm-hmm. Tubules here. And this is what is it? This is the Bowman's capsule. Bowman. Maybe you remember Bowman, like Bowman University at Bowman.
Yeah.
Yeah. So Bowman's capsule, where you see the afferent vessel brings blood, and the efferent vessel, is smaller, So when blood comes here, it comes into this, capillaries, and it filters. Yes. Okay. So the nephron is the unit. That's for that. But alveolus is also the functional unit for the lungs. So when oxygen comes into here, this is a space where the air enters the lungs, you understand? Mm-hmm. Then it filters through this tissue. Yeah. As it filters into the tissue, then it's carried onto the other parts of the body. So the alveoli, there are very, very many alveoli, in each lung. So you just remember here the lung is elastic structure, and they are divided into different parts. Okay, then what again? If you take in pure oxygen, yeah, your lungs will be okay. But if you take something when there is pollution from the factories, you see the air is not very clean, then you find that sometimes there could be some problems. Some diseases of the lungs that could be like smokers, people who smoke.
Yeah, that is very bad.
Yeah, it's never good to smoke because that's what we call emphysema. You understand? Yeah. Emphysema. And then tuberculosis, tuberculosis. And then other parts, diseases connected with the lungs. So with emphysema, you will see the lung could be destroyed. Water will fill the lung cavity, and here the oxygen cannot move through. You understand?
Yeah.
And also you could measure your tidal volumes, how you breathe normally, okay? But there are some other volumes, like 500 mils and all other things. Okay, so about the lungs, remember, the lungs, as we said, it's here. It's one of the most vital organs in the body, and connected with the heart too. And then connected also with the spleen. There's another part, of the body we call spleen. Yeah, spleen helps to maintain if the white blood cells destroys, some things, they are stored in the spleen.
Yeah.
Okay, and also here the liver, hepa, is just around here, also in the thorax, working together. Well, I think.
I understood like the main part.
Yeah, these are the just major things we could just discuss with the lungs. And sometimes, if you have some phonoendoscope or stethoscope, if you put it here or here, you could see how they, or maybe whether you could just put here the lung in between the vertebrae here. Yeah, you will feel, then you will hear, as the lung, even when you are breathing.
Yeah, that is very long.
Yeah, sometimes there's what we call thoracic breathing and then abdominal breathing, just different types of breathing
like
during
singers,
auscultation.
Singers,
they need to be able to.
Especially men breathe when they sing.
Yeah, in the opera.
Breathe with their stomach.
That is it. So you know that?
Yeah,
that's
I
good, right?
sing. I sing.
Yeah. Oh, yeah, sing it too. Okay, very good. All right, so, well, in conclusion, please protect your lungs. No smoking, and not too much of maybe exercise that would make your body too tired. Because sometimes when you breathe, sometimes, God forbid, it could lead to maybe death if it is too much, if you could not maintain it. But if you practice like people who run marathons, sure, it's okay. It's just for some time. All right.
Okay, so
any question?
No, thank you very much.
Oh, thank you. God bless you.
Thank you.
Shalom. It's good. So, take care. It's so interesting. Very nice. So, wishing you all the best, man. Dr. Miran.
Yeah.
All right. Thank you.
Goodbye.
All right. Bye, everybody.